All right, let's jump right in. The ECG, for anyone in medical training, it's a skill you absolutely have to master. But let's be real for a second. That grid of squiggling lines, it can look super intimidating at first. So today, we're going to demystify it. We're going to build a solid, step-by-step system for analyzing it. Even with all the fancy new technology in cardiology, the good old ECG is still king. It is our go-to for pretty much everything, from figuring out heart rhythms and spotting ischemia, to checking on valvular disease, pericarditis, and even keeping an eye on how certain drugs are affecting the heart. Its diagnostic power is just huge. And this right here, this is the core idea. The secret to mastering the ECG isn't about trying to memorize 1,000 different squiggly patterns. No way. The real key, the thing that separates a beginner from an expert, is having a reliable, step-by-step method that you use every single time. And that's exactly what we're going to build today. So, here's our game plan. First, we'll quickly cover why this is so important. Then, we'll learn to read the ECG grid itself, the language of the heart, if you will. After that, we'll decode the individual waves, lay out our systematic guide, and then finally, we'll put the whole shebang together. All right, section 1, the ECG's vital role. We're starting here because, look, you gotta know why this matters. And to put it simply, this is a skill you just can't get by without in clinical practice. It's non-negotiable. Okay, on to section 2. Before we can read the story, we have to understand the language it's written in, and that language starts with the ECG grid. I like to think of this grid as the actual paper that the heart's electrical story gets printed on. And that grid, it's really just a plot of two simple things. The horizontal axis, that's measuring time. And the vertical axis, that's measuring electrical amplitude, or voltage. That's it. Every single wave, every interval is just a measurement of these two things. So let's get specific. When the paper is running at the standard speed, each tiny little square you see moving from left to right represents exactly this: 0.04 seconds. 40 milliseconds. That's our basic unit of time. And if you look vertically at the standard calibration, that same little square represents an electrical potential of 0.1 millivolts. So there you have it. Time and voltage. Those are the two fundamental units of this whole electrical story. Okay, let's move on to section 3, the building blocks. We know what the grid means, so now it's time to decode the actual waveforms, the letters and words of the heart's electrical language. First up, we've got the P wave. This is where the whole cardiac cycle kicks off. It represents that electrical signal spreading across the atria, which is what makes them contract. A normal P wave is pretty small and should be less than 3 of those little boxes wide, so less than 0.12 seconds. Next is the PR interval. This measures the time it takes for that electrical impulse to get from the atria, pass through the AB node, and head down to the ventricles. That little delay is super important for timing everything just right, and it normally takes between 0.12 and 0.20 seconds. And here we have the main event, the QRS complex. This big, sharp spike is the electrical signature of the powerful ventricles depolarizing. It happens really fast, normally lasting less than 0.10 seconds. Right after the QRS, we get the ST segment. Now, this is a pretty quiet period electrically. The ventricles have just contracted, but they haven't started to reset yet. Here's the critical part. It should normally be totally flat, right there on the baseline. If you see any elevation or depression here, that is a huge red flag for problems like ischemia. And finally, we have the T wave. This represents the electrical reset or repolarization of the ventricles. It's basically them getting ready for the very next heartbeat. And that completes the electrical story of one single cardiac cycle. All right, let's get to section 4. This is the absolute core of what we're talking about today. We have the letters and words. Now we need the grammar. This is our systematic guide to interpretation. Because this is the real question, isn't it? You're staring at this ECG with all these individual parts. So where do you actually start? How do you make sense of it all without getting overwhelmed or worse, missing something critical? You start right here with this 8-step system. I want you to think of it like a pilot's checklist. First, you get the basics, rate and rhythm. Then you get your bearings, the axis. Then you measure the timing, the intervals. After that, you inspect the shape of everything piece by piece, the P wave, the QRS, and the STT wave. And only then, at the very end, do you put it all together for your overall interpretation. Let's walk through a bit of it. So you kick things off with step 1, rate. but it's really tied to step 2, rhythm. The first thing you do is just glance at the rhythm. Is it regular or irregular? If it's regular, you can use this awesome little trick shown here to estimate the rates super fast. Just take the number 300 and divide it by the number of big boxes between the QRS complexes. It's a quick and dirty way to get a really good estimate. Next up is step 3, axis. The best way to think about the axis is like the heart's electrical center of gravity. It tells you the average direction the electricity is flowing. Normally, it should be pointing down and to the left, somewhere in that -30 to +90 degree range. Now, after you figure out the axis, you'd move on to step 4, where you meticulously measure the intervals, like the PR and the QRS duration, to check for any kind of conduction delays or block. Now, when the axis is off, that's a huge clue. If it shifts way over to the right, past +90 degrees, we call that right axis deviation. This immediately points you toward conditions that are putting a strain on the right side of the heart. And it tells you to look extra carefully at the morphology in the next steps, steps 5, 6, and 7. For example, right ventricular hypertrophy doesn't just cause RAD, it also changes the actual shape and size of the QRS complex. And on the flip side, if the axis shifts way to the left, past -30 degrees, that's left axis deviation. And just look at the list of possible causes here. It points to a totally different set of problems. See how this works? By systematically checking rate, rhythm, axis, intervals, and then carefully analyzing the P-wave, QRS complex, and STT segment, you gather all the clues you need for that final step. Step 8, a confident interpretation. And that brings us right to our final section, putting it all together. This is where the system really empowers you to stop seeing a bunch of lines on a grid and start reading the complete story of what's happening inside the heart. So if there's just one thing you take away from all this, let it be this: follow the system every single time. I know it might feel a little slow at first, but that discipline is your safety net. It's what's going to stop you from jumping to a conclusion and missing something subtle, something that could be a critical, life-threatening abnormality. So we'll end on this thought. You now have the fundamental pieces, and more importantly, you have the systematic framework to put them all together. So the question isn't, what do these lines mean anymore? The real question is, what story is your next ECG going to tell you?